Now, China's making headlines yet again, and it is another kind of a mysterious infection. It is described as some kind of a pneumonia outbreak. Now, what is concerning is that this pneumonia outbreak is mostly affecting young children. And the World Health Organization has now made an official request for more detailed information regarding the reported infections, and especially the clusters of pneumonia infections in northern China. Earlier this month, China's Health Commission had told a press conference that there was an increase in the incidence of respiratory diseases, attributing them to the lifting of COVID-19 measures. The WHO has asked Beijing for detailed information on this. The WHO noted that it is unclear whether the outbreak in northern China and the overall increase in respiratory infections were linked. The WHO's proactive approach is because of the first cases of what turned out to be COVID-19 were reported as unexplained pneumonia back in 2019. Now, according to a statement on Wednesday, the WHO had requested additional doctors and clinical information as well as laboratory results from the reported clusters amongst children. It further said that we have also requested further information about recent trends in the circulation of known pathogens, including influenza and the current burden on healthcare systems. Meanwhile, safety practices seem to be a casualty, even as China pursues its ambition to become the science superpower that it wants. The Beijing claims that it is on the path of expanding the country's biotechnology sector, and billions of dollars being pumped into constructing dozens of laboratories and encouraging some cutting-edge research. However, safety practices in China's new labs have failed to keep up pace with the rapid expansion. The report citing multiple probes are highlighting as to what experts are describing as China's vulnerability to serious lab accidents. It's also raised a lot of fears of deadly pathogens escaping and once again potentially triggering another pandemic. Now, experts who visited the Chinese facilities have reported equipment problems and also inadequate safety training. Now, experts say what makes the problem worse is China's secretive top-down bureaucracy that sets ambitious goals while also covering up accidents and discouraging public acknowledgement of shortcomings. All right, now to give us more perspective in terms of what, of course, is happening in northern China at this point of time, we're being joined by Dr. Sarah Pitt, who's a virologist from the University of Brighton, and she's joining us live on this broadcast. Now, Dr. Pitt, the cluster of pneumonia-like mysterious infections that have been reported in parts of northern China have raised a lot of alarm bells. What do you think is going on? Because this is very similar to what the Chinese had reported, some kind of mysterious infections in 2019 at the time of the COVID-19 outbreak.
Yes, hello. The World Health Organization have asked for more information, and what they're suggesting is that it might be influenza, it might be a thing called respiratory syncytial virus, which mostly affects children, or it could be mycoplasma pneumoniae, which is also causes pneumonia. It's an unusual sort of pneumonia, and particularly in this case, it's affecting children. The thing that's making it less likely to be a whole new pandemic is that it only seems to be affecting children at the moment. That's unusual. It's quite likely, I think, although we don't know for sure, but it is quite likely that it's because China, if you remember, in China they had very, very strict lockdown for a very long time, and now they're opening up. The children are at school and playing and mixing and matching, and normal childhood respiratory infections are spreading around in the way that they've been suppressed until now. And We've seen this in other countries. We've still seen this in Europe, in the USA, that after lockdown, we had unusual respiratory infections in children particularly.
For lay people who don't understand, how viruses spread, but the fact that this disease is affecting only children, does it actually not make it a bit more complicated? Because children do not follow social distancing as much as we would want them to. And the fact is, because it's children who are getting affected, we do not know as to what this could lead to.
Well, yes, I mean, it makes it more complicated to control it among the children. But if adults are not being affected, if adults are not getting sick, then that suggests that it's a common common childhood infection.
Right.
These children didn't have it during during COVID, whereas their parents will have had it already. So, although we don't know for sure, but if the reports are coming from China are correct and accurate, they're saying it's children who are going into hospital with this infection, and it may be more than one type of infectious agent which is causing similar symptoms, which is also possible. But the fact that it's only in children means it's difficult to control in those children, but not necessarily that it's going to spread as widely.
Absolutely. Thank you very much indeed, Doctor, for joining us and getting us those insights there.
Thank you.
WION is now available in your country. Download the app now and get all the news on the move.